This podcast is Module 14, the concept of nutrition. These are your concept learning outcomes. This is a basic definition of nutrition. And Healthy People 2020, we talked about that as it related to other problems. But these are some of the goals of Healthy People 2020 when it comes to nutrition. Genetic and lifespan considerations. We want to make sure that infants and children have adequate nutrition because it will affect their physical and mental development. During the first year, an infant's body weight triples, and American Association of Pediatrics recommends breastfeeding exclusively for the first 6 months and then continue as foods are introduced in the first year. For those who are unable to breastfeed, there are many ready-to-feed formulas available. Genetic and lifespan considerations, nutrition for adolescents. Adolescents are going through a very rapid physical and growth spurts, require more calories, but there can also be some struggles with appropriate food choices. So there is pressure on females to be thin, and this is when extreme dieting and eating disorders are usually developed. Pressure on males to gain muscle mass so that they look, big and hunky, and this puts pressure on the bones. Overweight, obesity can lead to depression, hypertension, type 2 diabetes, poor self-esteem. So, nutrition for adolescents, Healthy People 2020 is focusing specifically on this age group. And what they are doing is involving the schools for what foods they offer during the school day, after school, and there are programs that actually will send backpacks with food home with children who need it. So just some variations. 36% of Americans are classified as obese. Yes, adult men require more calories than an adult woman, and the need for the calories usually decreases around the age of 50. Females of childbearing age need to make sure that they're consuming extra iron and vitamin C, folic acid. Nutrition for older adults, they have unique nutritional requirements. Typically, our older adults are going to be deficient in vitamins D, B6, B12, and calcium. Risk factors for undernutrition is there's a decrease in salivation. It affects the taste. Their chewing may be affected by loss of teeth, ill-fitting dentures, dental caries. There is a thirst dysregulation. They may not realize that they are lacking fluids that they need. There is a decrease in the number of taste buds. Also, they may have cognitive impairment, constipation. Older adults are prone to polypharmacy. They're seeing several specialists. They have different medications, and they may cause nutritional problems also. Obesity in older adults puts them at a much higher risk for cardiovascular disease and diabetes. And some of the ways to help improve nutritional intake, first of all, have food and snacks available, something they can just grab very quickly. Dining room is preferred to eating alone. And family caregiver support. There are also things like Meals on Wheels where people can get food delivered to them. Undernutrition increases the risk of infections in children. You may notice that some children have a diagnosis of failure to thrive, so resulting in the failure of growth. There's poor wound healing, muscle loss, And individuals most at risk are those with any chronic illness, the poor, the elderly, hospitalized, anybody with an alcohol abuse problem, and anybody who restricts their eating for reasons that aren't medically necessary. Overnutrition due to increased intake of refined foods, animal fats, proteins. It is linked to obesity, diabetes, cardiovascular diseases. Excess body weight increases all-cause mortality of most adults. Prevalence of obesity, overweight in children, adolescents has doubled in the last 30 years. Multidisciplinary approach needs to be taken when we're talking about childhood obesity. It needs to involve the school, it needs to involve families. So more than 1/3 of the U.S. adults are obese, and like I said earlier, it leads to heart disease, stroke, type 2 diabetes, certain cancers. According to the World Health Organization, obesity is a worldwide problem, not just in the U.S. Significant yet preventable health risks. And the National Association of Anorexia and Associated Disorders has statistics on individuals with eating or feeding disorders, so you can look at those. Some non-modifiable risk factors. Somebody may have allergies to specific foods, limiting those. Somebody may have a lactose intolerance. Adjustment of carbohydrate intake with the client with diabetes. These are things that they may have to limit their carbohydrates. Increased risk of obesity with age. There are hormone level changes, sedentary lifestyle, body fat increases, muscle mass decreases. Nutritional intake is, for your modifiable risk factors, atherosclerosis, osteoporosis, age-related macular degeneration, hypertension, some cancers, and life expectancy differences around the world. Again, if you keep these illnesses under control, then that is something that you can modify. Screenings to identify the need for further evaluation. Body mass index is a ratio of height and weight. We'll be not calculating those in class, but there are charts available to determine somebody's BMI. So Joint Commission requires a nutritional screening within 24 hours of admission to the hospital. And if somebody has been in the hospital for more than a week, a nutritional assessment needs to be part of their daily plan of care. So some of the common risk factors we talked about. There are modifiable and non-modifiable. We're going to do a review of nutritional history, food intake. We're going to be looking at labs, looking at food and drug interactions, health history. We're going to talk about in class some of the questions that you need to ask related to nutrition when you're doing your health history and your physical assessment. So we will talk about that in class. These are pictures of some physical signs and symptoms of nutrition. First one, cachexia, is an older person, and that is pretty much a muscle wasting, lack of calories to maintain a healthy body. Marasmus is the same as cachexia, only we see marasmus in children, and that again is a lack of sufficient calories for normal growth and development. Kwashiorkor is a severe protein deficiency, leading to liver failure and ascites. So when you look at a child that has this big belly, you may not automatically think that it's a sign of malnutrition, but it is. It will affect physical growth and mental development. The little girl with kwashiorkor was a little girl that we took care of in Kenya when I had students in Kenya. Nursing assessment. Initial assessment of nutritional status. You're going to be looking for signs of malnutrition. Page 937 has a good graphic of multi-system effects of malnutrition. So look over that. Height and weight, eating habits, ability to chew and swallow, mini nutritional assessment is on page 941. Okay, so in class we are going to be practicing a nursing assessment as it relates to nutrition. So we're going to do a health history. We're going to talk about questions you need to ask, what data you need to collect, and then the physical assessment. Cultural considerations, change across the lifespan. You can read all of these cultural considerations. One thing I wanted to point out, this picture is from a market in Kenya when we had students. And we take them to the market so that they can see what people have access to. Obviously, there are a lot of grains, beans, rice, looks like bananas, but I'm not seeing any fresh fruits, vegetables, meats. So, you have to take into consideration what's available for people. And that is all I have. Again, we will be doing a nutritional assessment in class, but just make sure that you understand the overview of what we're going to be doing.